Paul Simon has brightened the lives of millions of people with his music, but now he's making a lot of people smile in the hurricane zone for a very different reason. He and Dr. Erwin Redlener are the men behind Operation Assist, which is mobile medical units treating the victims of Hurricane Katrina. Dr. Redlener is a pediatrician and the director of the National Center for Disaster Preparedness at Columbia's Mailman School of Public Health, and both men are in Biloxi, Mississippi this morning. Hi, Paul. Hi, Erwin. How are you guys?
Great, Katie. How are you?
Good morning, Katie.
I'm fine. Listen, I know, Paul, you arrived here yesterday morning along with 2 mobile medical units. Erwin, I'm not sure how long you've been here, but what has your reaction been to the devastation in Biloxi? I know that Biloxi and Gulfport were hit so hard and were pretty much decimated, right?
Well, physically, the devastation is of biblical proportions in large swaths of Biloxi and the neighboring towns. Psychologically, spiritually, the community seems to be holding together very well. They're very supportive. They're innovative in their capacity to solve the problems in terms of food, supply, evacuation, things like that.
There's a tremendous amount of destruction, Katie, and I think that we're just now beginning to see some of the huge numbers of people that will need both medical attention for everything from infected wounds and now the beginning of some intestinal infections from stagnant and water that's carrying all kinds of infectious problems, but also we are worried about the long-term psychological impact. As Paul said, it is remarkable how resilient people are, and it feels like, just being here for a little bit, that much of the resilience is being generated by the local communities themselves. And you're actually seeing surprisingly little organized outside help, but really this community has really organized itself in ways that are very impressive.
I know, Erwin, that what dysentery caused made, I guess, 25 people sick in a shelter, and I guess they must be on the lookout for other diseases that are the result of the flooding and of the hurricane, right?
Yeah, and there's a lot of environmental hazards that are sort of left behind in the wake of this. So Paul and I were being told yesterday about some areas that are just absolutely covered with sludge that's completely contaminated. We were hearing about huge numbers of spoiled food products that are all over the place that were ready to be shipped out to other places. For example, the shrimp harvest was at its peak, and that became rotting shrimp, rotting chickens that had been waiting for to be exported out of here. All of those become ongoing environmental health hazards for the people that are trying to make some recovery happen.
We should talk about the Children's Health Fund, because you and Paul founded it back in 1987, and now you have 25 mobile medical units all across the country serving underprivileged communities. In other words, if they can't get to a medical center or to a hospital or to a doctor's office, you guys go to them. So what kind of work have you been doing in Biloxi?
Well, we started out 19 years ago concerned with bringing pediatric care to poor children. But what we found, particularly after Hurricane Andrew, was that the mobile units are an extremely effective tool in disaster areas. They can stay in a fixed location, and people can come when they hear about it. We can come in an emergency, as we had last night when we heard that there was a 3-week-old child who was suffering possibly from dehydration, and we went to the projects there and brought the unit there. So this particular way of dealing with disaster has flexibility and a great effectiveness. I wish we had 10 more of these units. In fact, these units cost about $300,000 a piece. It would be $3 million to get 10 more units, and I wish we had them parked all around in the southeast, because the hurricane season is just starting. There's going to be more, and there's going to be a hurricane season every year, and we should be prepared now. We should learn something from from this disaster and not find ourselves overwhelmed as we are right now.
We've had tremendous support, by the way, from our partners to make this thing happen. So United Healthcare, Wyeth, and the School of Public Health, the Mailman School of Public Health of Columbia have all sort of banded together and make this happen. And we'll be in Louisiana tomorrow with 2 more mobile units coming there later this week.
And real quickly, Erwin, before we go, we have about 15 or 20 seconds, but what do you think is the most important lesson learned from this disaster?
The most important lesson is that the United States of America, Katie, is absolutely not prepared for a major catastrophe. We have a lot of soul searching to do about what's happened over these last 4 years, especially since 9/11. We have to rethink this in a very different way. We have to make sure that there's going to be suffering from natural disasters that we cannot possibly avoid to a certain extent. But I think we could do a much better job in making sure that American citizens are prepared for the kinds of catastrophes. Don't forget, we have the potential of pandemic flu coming this year. We're not prepared for that either. So while we're dealing with this rubble and this human misery, which we need to do as quickly as possible, we need to get much better organized in being prepared and in our ability to mount an effective, coordinated, directed response, which we certainly have not seen very much in the aftermath of Katrina.
All right. Well, Erwin Redlener, Dr. Redlener, and Paul Simon, thank you guys so much, and maybe I'll see you tomorrow in New Orleans.
Thanks, Katie.